Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow, MD, and Dr. Thomas Grove, DO, from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Dr. Grove is a regenerative medicine specialist and an expert in ultrasound-guided injections with extensive experience as an athlete and strength and conditioning coach. Today's program could open up a new life without pain for you. To speak with Dr. Darrow and Dr. Grove, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Now, here's Dr. Darrow with his co-host, Dr. Thomas Grove.
Dr. Thomas Grove, how are you feeling today?
Dr. Marc Darrow, I'm living it up. How you living over there?
It's the best ever, man. I can't believe how good it is. I thank the good Lord every minute. I'm grateful for everything. And I'm super grateful for you being with me, working with me, and doing the good work that you do in healing people. And the healings that we do really are healings. It's not cutting people up, and it's not causing big problems for people that we see all the time. And we love the surgeons. We just don't like all the surgeries they do that we don't think they need to do. And we get a lot of people that come in after a surgery, like my shoulder surgery that I had in medical school that didn't work out well for me. It was my professor who did it. I loved him. It just didn't work out. And I had about 4 years of misery after that until I learned about regenerative medicine. And I experimented on my own body. And as you know, I've injected my knees, my shoulders, my elbows, my wrist, my neck, my back, all my ribs. I know you've injected yourself also. Mm-hmm. And we both had great success using stem cells and PRP, which is platelet-rich plasma. And it's a great life we have to be able to do this, not only for ourselves. I mean, it's great. We can just inject ourselves between seeing patients and get back to work. It's so easy.
Oh, yeah. I was talking with patients this week and like how blessed we are that we can actually heal the body, right? Heal tissue. We're not covering it up, right? We're not doing things like steroid shots. We're not frying nerves like a radio frequency ablation, right? We're not doing these invasive procedures. What we do is we just take the body's healing cells, right? Platelet-rich plasma, do a simple blood draw, spin it down, inject it back in. Or we can do bone marrow aspiration, get some good stem cells, good platelets in that, right? Good healing cells in the body. Very, very natural stuff here. We're just putting it directly on target using musculoskeletal ultrasound, right? Those are our eyes. We can guide that needle the whole way in. Be very safe about what we do, but it's a very feel-good profession, no question about it.
So I got a question that came in, and as people know who work with us, we have a website where you can email us, and that website is www.jointrehab.com. That's JOINTREHAB.com. It's got tons and tons of educational material on regenerative medicine of platelets and stem cells, and we get emails all day and all night. We answer them every day. First thing I do when I wake up in the morning is I answer emails. I do it between seeing patients. I do it at night when I get home. And Dr. Grove and I give out our cell phone numbers too. So we talk to patients day and night. We like to keep close contact. That's part of our healing regime. But anyway, a question came in, and it says this: I'm having continual pain in my right hip. I'm thinking it's a torn labrum. MRI with contrast did not show a tear. Doctor told me that 30% of the time, tears are not depicted in MRIs. Doctor wants to go inside and take a look arthroscopically. I'm hesitant. Don't want to deal with the recovery time, especially if no tear is found. So, Dr. Grove, why do doctors want to go in surgically to find out if there's a problem?
I mean, there's a lot of different ways to do it, but I mean, it's a really easy way to get somebody into surgery, right? We don't know what's going on, so we should go in there, do damage to an area, right? And that's the big thing people don't understand. If you're putting, a scope into a joint, right? You're looking at a hip joint. What you're doing is you're compromising that joint capsule, so now you have more instability of that joint. When you're actually putting that scope in, a lot of times you rough up that good, healthy, articular cartilage. That's that tissue that allows that joint to glide very smoothly. And when that wears out, you get arthritis. So what happens when you have these sort of surgeries is you get instant instability and more arthritis. We're not a big fan of these surgeries. We'd much, much rather put hands on the patient, do a very in-depth physical exam, and do a non-invasive imaging modality like ultrasound right there in the clinic to put that whole picture together. I had a patient this week, very similar situation to this.
That's why I raised this issue for you, because I remember.
Yeah, I had a couple this week where they're really fixated on it's my labrum. I had one person, they had an MRI that actually showed a very small labral tear. But you have to understand is the labrum, it's like it's a really tough piece of fibrocartilage. It's like really tough plastic when you actually dissect these things down. What it does, it's like a suction cup. It keeps that ball suctioned up into the cup. And certainly if you have a giant, massive tear, it could flip into the joint space and cause what we call obstructive symptoms, meaning a lot of clicking, catching. You can't put weight on it. Those are big sort of mechanisms of injury. The patients that we see in our office that are walking around with these little labrum tears, we should not be operating on, in our honest opinion.
How do those labral tear surgeries come out anyway?
Yeah, not great. Again, what you're looking at is you're doing more damage a lot of times than you are doing good. And if you're doing a surgery on a body part that's not causing your symptoms, what are we really doing? We're putting the patient at risk of having a complication from that surgery.
Also, we had a gentleman come in Friday who had labral tear surgeries on both of his hips and was complaining of a lot of pain. So when I examined him, and I wasn't in the room when you examined him, so we could look together, but when I examined him, his pain was not anywhere near the hip joint or the labrum. It was where the anterior superior iliac spine is, the front of the pelvis, where muscles attached to. And he could not understand, no matter how I showed him. And the way I explained it is this. If you're out in the universe somewhere and you're looking down at Mars, the Earth, Venus, you name it, they all look like you're in one spot close together when you're a million miles away. And that's how people look at the body. They go, well, this is my hip. Mm-hmm. When it's not the hip, it may be an inch away, which is devastating to do a surgery that's an inch away from the problem, because it's not going to take care of the problem. It won't take care of the pain generator. Mm-hmm. And we were not able to convince this guy. Did you have the same exam that I did with him? Yeah, and it's unfortunate. We talk about it every week, but if we get too zeroed in on what your image finding says, right, the pathology, you have to understand that doesn't line up with the reality, a majority of the time. For things like labrum tears, I think there's great studies on this. There's always a good opportunity to talk about, what are the studies that are out there. Study in Arthroscopy 2015. Again, surgical journal. Title of this study was Prevalence of Femoroacetabular Impingement, Imaging Findings in Asymptomatic Volunteers, a Systematic Review. You have to understand, a majority of patients are walking around with these sort of pathologies and they have no pain whatsoever. So to go attack those things with surgery is a very risky business. That's why we're so passionate about this. If you don't really find that pinpoint pain generator, you're really putting yourself at risk. Yeah, it's devastating for me, emotionally, to see these people come in after failed surgeries when the surgery did not even address the pain generator, which may have been close to what the MRI or X-ray showed, but it was not the target of the problem. And that's the greatest thing about the work we do using stem cells and platelets. We can find the actual target, what we call the pain generator, and put cells in there that actually grow the tissue back and heal it and rejuvenate it. So, we're scratching our heads every day. Why are the surgeons who have these journals that tell them not to do these surgeries, why are they doing them? It doesn't make sense to us. If you're going to do a surgery on something that fails, why do it? And this is not just in the hip. This is in the knees with meniscal tears. We have people come in, their menisci are chopped out. They have immediate arthritis after the surgery. What was the point of that? We can use the ultrasound and put in a little teeny needle, a 30-gauge needle, and put some stem cells or platelets in there and regrow back the tissue. How do I know? Because I've done it on both my knees. I had meniscal tears on both my knees, And I was on crutches for a while. And it was back in the COVID days when we weren't allowed to ride in a golf cart, and I play up at Mountain Gate, which is just like it says, very mountainous, up and down. So I had to walk and push a cart, and both my knees blew out. And I took a look with the ultrasound. Actually, one day I almost finished up. I was on the 8th hole. I couldn't walk anymore, and I drove back to the office, and I put an ultrasound on my knee, and I saw about. It actually turned out to be 45 cc's of fluid in my knee, which is quite a good amount. So I called up Jeff, our medical assistant. I said, "Can you get over here? I got to drain my knee and put some stem cells in it." And we did that 4 days in a row, which is not common. We don't usually treat that frequently. And I healed my knees up within the week. So this is something that can work quickly. It's not magical. It just makes sense. It's just natural healing. Dr. Grove, do you want to give out our phone number and information on the studio here?
Yeah, of
and
course.
At the office, and we'll get some callers in, hopefully.
Yeah, we'd love to talk to you guys. Again, to give out a fake name if you need to, but if you're having an ache or a pain, you or a loved one, you want to talk about it, give us a call here live in the studio. The number to call is 866-870-5752. That's 866-870-5752. We'll give you a copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. We even pay the postage for you on that. And again, if you want to get a free consultation over the phone with our staff, give us a call. We're at 800-300-9300. That's 800-300-9300. And like Doc talked about, check out our website. Lots of great information on there. Lots of good studies, videos of us actually doing these procedures. Spot on every page to give us an email if you have any questions or concerns. Again, we answer emails every single day. We really want to make sure we're getting you help if we think you're a good candidate. Check us out. We're at www.jointrehab.com. That's www.jointrehab.com.
So I was just flashing through the book as I was showing it to the camera, and it talks about SLAP lesions. Do you want to tell us what that is? Because the study that I have here says they may actually be rare injuries. Why are they being operated on all the time?
Yeah, so just like we have a labrum in the hip, we have a labrum in the shoulder. Again, what it is, it's a really tough piece of fibrocartilage that keeps the two bones, together in that joint, so it provides a lot of stability to a joint. So a SLAP lesion is going to be a superior labrum, so the top part towards your head, part of that labrum, and it goes from the front to the back, or anterior to posterior, so SLAP. Again, we like to characterize things and be as specific as we can on radiology, so that's just kind of a special name for the location of where that labrum tear is. But very, very similar setup. We see a lot of labrum tears in shoulders. I remember we had a bunch of Olympic swimmers come through when I was doing my fellowship, and we'd scan everybody just for fun because we had to do our diagnostic scans. And we found labrum tears in every single one of them. Right now, these people who weren't very productive, they're having horrible pain, they couldn't swim anymore. No, these are people that are the top of their field, and they're swimming around with labrum tears. And that was a real big eye opener for me, realizing that just because we have pathology on an image does not mean that's going to be something that limits you. Doesn't mean that's going to be the cause of somebody's symptoms, whether it's instability or pain. So we got to be very careful about what we see on these sort of imaging studies.
So I'm going to give you a kind of wild card here because we don't see that many of these, but we do see quite a few, and I've probably done a few hundred in my career. I've been doing this 27 years. It's called TMJ. Mm-hmm. So in this question, this person says, well, it's very simple. They say, I'd like a consultation to discuss PRP injections for the TMJ. What is the TMJ, and how do you treat that?
Yes, I actually did a couple of TMJs here this week. So TMJ is basically, it's your jaw joint, right? Temporomandibular joint there. So what ends up happening is we kind of have a lot of distractors in that area. Sometimes it's not the joint. Sometimes it's just the little muscle attachments around that. But your typical patient's going to come in saying, yeah, man, I have a lot of pain when I'm chewing. Sometimes I feel like my jaw is just off when I'm opening and closing my mouth. Sometimes it gets so bad where I have just a hard time, getting a whole meal down. Sometimes it's clicking or catching that's in there. And we like to, again, really overcomplicate things in medicine. What is it? It's a joint, right? You've got bones that are articulating over one another with some articular cartilage there. Just like anything else, things can get worn out. I saw a lot of TMJ issues when I used to inject a lot of professional fighters. So people, getting hit in the jaw all the time, that can be very traumatic to that joint. But again, getting back to the basics, if you have a true joint issue, the only thing that I've ever found that actually regrows that tissue and gives you long-term solutions is regenerative medicine.
And personally, in my practice over these last 27 years, I have seen so many people that are ready for a surgery on their TMJ, and their friend told them about us, and they come in, we do PRP or PRP and stem cells, and it heals up. They never needed the surgery. And I've had tons of people who have had the TMJ surgery, which failed, and then the regenerative medicine will heal it up. So it's really, really important in medicine to follow the first law of medicine, which is do no harm. That's our first law. How do we do that? Number one, I'm going to sound silly, stay away from doctors if you can help it, because there's a lot of things doctors do that are invasive. If you go to a doctor, do the most natural thing you can. We're fans of acupuncture, massage, whatever it is out there, any kind of therapy that's natural. We are not fans of doing surgery unless there's things like broken bones. You need a surgery for that. There's no question about it. But we just see way too many surgeries being done. Medicine I call the dinosaur. It's slow moving and it's ancient. And it takes very long for things to change in medicine. It's a culture that's very, very slow moving. And luckily, Dr. Grove and I jumped on the bandwagon very early to learn about how to heal naturally by just simple injections. Walk in the office, get your blood drawn, whatever it is you're going to do, and it's very simple. You get an injection and you walk out. Even if it's your foot, knee, or ankle, or hip, or whatever it is, you walk out. And you don't need anybody to drive you. It's a very conservative procedure. Very simple side effects like stiffness overnight, usually. Sometimes people are stiff longer. Sometimes people don't get stiff at all. But compared to a surgery, it makes no sense to me why people and why surgeons are not doing regenerative medicine while they're using a knife. In most cases, it makes no sense to me.
Yeah, it's very frustrating when you hear a patient talk about how I wish I would have known about this as an option. And so we end up being discovered, after they've had sometimes multiple surgeries that gave them no relief, or maybe they had a complication and now they're back against the wall. Like, well, what else is out there? Again, we think of the system as it's not very straightforward. We should be doing conservative things first and working our way up into very invasive procedures like surgery, joint replacements, things like that. But unfortunately, our culture is very surgically driven. So we get a lot of patients who have that surgery first and then they discover us. We wish it was the other way around, where we can go conservative first, certainly. But it just came out of my head here, Doc. I was talking about a patient this week who they're trying to get put on prednisone for some pain, right? And again,
my God, that's the worst thing you can do.
So prednisone is a very strong corticosteroid. It's a very strong anti-inflammatory, which again, I get what's going on, right? You get a patient in your office, they're in pain, you want to give them something to have that pain go away. But what really bothered me is they said that their physician was telling them how it was going to heal their issue, right? Which could not be further from the truth, right? Prednisone, steroids, these things actually break
cortisone,
down.
Any ONE is a steroid.
Kenalog, that's another one that's very common. You have to understand, guys, these are substances that are not very good for tissue. It actually wears down tissue, wears down articular cartilage, right? Now, it can be temporary pain relief because it's strong anti-inflammatory. What ends up happening is that pain comes back stronger and you kind of limit your body's own ability to heal. So again, it's another way to treat the human body. We're not big fans of it. It is definitely not conservative. There's lots of side effects with these medications, but it does not heal tissue. So I just wanted to make that point.
And back in my tennis days, before I was a doctor, I was a lawyer, and I had tennis elbow. So I went to an orthopedic surgeon buddy of mine, and he gave me a steroid shot. I didn't know, cortisone. I didn't know the difference back then. And so I went back out, and the pain was gone instantly because there's lidocaine mixed in with the steroid. And went back to play tennis, and it got even worse. Mm-hmm. So I went back to him, and I said, it got worse. He said, okay, I'll give you another steroid shot. He did. Mm-hmm. Guess what? Went back out, played tennis, got way worse. I had long time period of pain with that until I learned about regenerative medicine. I injected myself, and guess what? My elbows, I actually had it on both elbows, have been fine now for, gosh, it's got to be 25 years or so. So we got to be careful. We got to be careful what we do. I know that doctors are very brilliant guys. We all have to get good grades to get into med school. But, personally, I think that doctors have blinders on, and they follow their culture rather than think for themselves and do what is best for the patient. So this is an interesting question. This person said, referred by so-and-so of flex and burn. I don't know what that is. I have my latest MRI. Can I send it to you for your opinion? What would you say to that person?
Yep, this is a text, phone call, email I get almost every single day. I got one here actually this morning. Just look at my imaging and tell me what's going on. Again, we have to get back to basics. Your image can tell one story, your body's going to tell another. I have no idea if your imaging results have anything to do with what your symptoms are. The only way that I'm going to tease that out is, again, putting my hands on you and doing a proper hands-on physical exam. There's so many great studies out there looking at asymptomatic patients, meaning people
that means patients with no pain.
Yep,
no pain, no nothing.
We image these people and we find these pathologies, right? If it's the back, it's degenerative discs and facet joint arthritis and maybe a slip disc, bulge discs, right? Shoulder, you're looking at things like labrum tears. You talked about a slap tear here today, rotator cuff tears, arthritis. There's a lot of things you're going to find on imaging, but you have to understand those things don't always cause pain for people.
So I'm going to give out the phone number, or actually I'll have you do it.
Yeah, absolutely. Give us a call, guys. We'd love to chat with you live here in the studio. Give us a call, 866-870-5752. That's 866-870-5752. We're going to give you guys a copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. That's the theme of the day, right? Regenerate and heal that tissue. Try not to operate on it unless you absolutely have to. We'll pay the postage for you in that book. Again, you're a loved one interested in that. Give us a call if you'd like to get a free consultation over the phone with our staff. That number to call is 800-300-9300. That's 800-300-9300. 9300. And if you want to check out our website, spot on every page to shoot us an email. Again, we're discussing these cases live on the air here. Again, we want to make sure we're getting you help here if we can. Check out our website, www.jointrehab.com. That's www.jointrehab.com.
So we get more knees than anything else, knees, back, shoulders. But we treat the whole body. It doesn't matter where it is. It can be muscle tears. It can be ligament attachments. It doesn't really matter because the body's made out of collagen, which is the structural protein of the body. And that's what we are stimulating to grow back. And cartilage, which is in knees, is very easy to grow back. I know when I was in med school and I was talking about this, when I learned about it, they told me they were going to throw me out because you can't grow cartilage.
Oh no! And Doc,
I was threatened many times.
We got a call. We got a caller coming in here. Man, I'm already getting fired up here in that story. Shane from Lakewood. How are you, Shane?
Hey, well, doing good. I just worked out. I just started working out again about 6 weeks ago. I already lost 18 pounds. I was 248. Now I'm 230.
Good for you.
I'm 16, so I'm kind of a tall guy. But I'm 61 years old. And I've had a knee issue for I've had a lot of issues, but because I used to be very athletic, judo and surfing for 25 years and just a lot of stuff. Anyway, so my right knee, I have, it's a tendon that flops over the bone every time I bend my knee, but it does, that thing doesn't hurt, but my knee, I have bad arthritis. I have bone on bone on my right knee. He wanted to do surgery, a good surgeon, orthopedic surgeon. I'm not going to say where he is, but he wanted to do surgery 3 years ago. I had it scheduled, everything, and I canceled it. So I've been dealing with it, and I just started working out, trying to lose weight and, just help my body, eating well. And the pain's there, and it's just really hampering my ability to do things I want to do. Like, I just want to walk like a couple miles. I walk around the block and it's hurting bad.
So Shane, this is Dr. Marc Darrow.
Yes.
We're going to go to the break real quick, and then we're going to come back because you have so many great issues that we want to talk about. You're going to be our star caller of the day, so please, please, please hang with us. And for those of you who want to call in, give us a buzz. in the studio at 866-870-5752. And we will talk to you in a moment.
You're listening to Living Pain Free with Dr. Marc Darrow and Dr. Thomas Grove. Their practice is located at the Joint Rehab and Sports Medical Center in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow and Dr. Grove will be back in just a moment. Stay tuned.